Just weeks away now from the January 1st deadline when WellNow will stop accepting Excellus Blue Cross Blue Shield insurance. The urgent care provider says there's still time for Excellus to reconsider contract negotiations for a higher reimbursement rate. Michaela Singleton breaks down a conference call with WellNow's chief medical officer.
Well, this is certainly nothing new, is it? Companies disagreeing about who owes who more money in their contracts. Well, for their part, the chief medical officer of WellNow Urgent Care does say in an update to media and elected officials across New York State that the cost to patients could go up, in fact, for hundreds of thousands of people. Dr. Robert Birnbaum claims not only does Excellus refuse what WellNow describes as a fair reimbursement rate, he says the insurance provider has been consistently paying out less and less for WellNow's urgent care services.
The response we've received so far is that we're being reimbursed similar to other like services. And I guess the concern that I have is I don't know what like services that they are referring to.
He argues urgent cares help keep primary care physicians and emergency rooms from becoming overwhelmed.
Our service truly is a go-between a primary care and an emergency department. And we have x-ray on site. We perform reduction of fractures. We take care of patients with sprains, lacerations. And those are things that are not done by primary care providers.
He says if the reimbursement arrangement is allowed to expire on January 1st, the average Excellus patient will pay about $165 in out-of-network costs versus an in-network copay. Dr. Birnbaum says his main concern is the effect on Medicaid patients and those in rural communities, which can sometimes be considered healthcare deserts.
We obviously would never want to close down a site that serves a rural community, because it's why we put WellNows in rural communities, because we know that there isn't a lot of other choices in healthcare.
There are currently 5 WellNow Urgent Care offices across our region, and the previous contract with Excellus had been operational since 2016. Reporting in studio, Michaela Singleton, News 8 WROC.
Thanks, Michaela. Excellus Blue Cross Blue Shield provided a statement this afternoon saying, in part, quote, "We continue to engage in discussions with WellNow regarding their contract. WellNow has asked for a rate increase that's significantly more than what local providers receive for similar services. Our concern is that when we pay higher fees, local employers and members can face higher insurance costs."